Hello everyone, my name is Emily Cossack and I'm the Knowledge Manager for the Canadian Institute for Public Safety Research and Treatment. Welcome to today's session, How Organizations Can Support PSP Dealing with the Opioid Crisis. Before we get started today, there are just a few housekeeping items I want to go through. First of all attendees are in listen-only mode. This is to limit the feedback and noise that can happen when you're unmuted. Today's session is being recorded. You'll be sent a copy tomorrow, so if you miss anything, you can certainly watch it again. Just so you know, the GoToWebinar launch window can be blocked by some organizations. So if you're having trouble hearing or seeing, you may need to join us by phone. Lastly, we will be looking for audience questions at the end of the presentations. So you can either send us your questions through the questions box, or you can raise your hand and I will unmute you so you can ask your question. Now, let me introduce our presenters for today. First, we have Chief Pierre Poirier of the Ottawa Paramedic Service. Then we have Deputy Commissioner Stephen White, and he's Deputy Commissioner for Specialized Policing Services at the RCMP. And last but not least, we have Dr. Megan McElheran from the Wayfound Group, who's also the chair of CIPSRT's ARC Network Clinical Subcommittee. So Pierre, I will just put your slides up and I will turn it over to you so that you can begin.
Yeah, welcome everyone, and I am excited to be here. And a large portion of it is the fact that we've just released a standard with respect to opioids for paramedics and helping guide their response to the opioid crisis here in our community. Emily, if next slide, please. Just as a matter of I think of process, I'm not being paid. I have no conflicts to declare, and there's no payment for my participation today. Next slide. Just, these are baseline facts. Fentanyl is 100 times more potent than morphine, and the analogs are even more of a problem. With respect to just kind of a little bit of a background, Sam Quinones wrote a book in 2015 called Dreamland. I think it's an incredible account of the devastation of opiates have had in the US. And it really is kind of a good, maybe I shouldn't say good, but it is also a reflection of what's happened in Canada and how devastating opiates has been to society as a whole, not just to those individuals who have had a use or an addiction issue. Next slide. Just a couple of more items in terms of context, with respect to what's happened with COVID-19. The popularity of the opioid issue is kind of, I wouldn't say fallen to the wayside. It's just that it hasn't had the same traction in the media. And the issue with that is that this issue of the opioid crisis, going back the last 15 years or so, has not abated. If anything, it continues to be a problem. And in some parts of Canada, it is still an overwhelming problem. The two data points here are from Health Canada, just noting that people are still dying, and a lot of people are dying. Maybe the small good point is that the fact of the hospitalizations is kind of held steady, and maybe that's possibly attributable to the amount of Narcan that's available in our community. But overall, the issue of opiates in our society has not gone away and continues to be a significant problem. Next slide, Emily. And here's just a few quotes just to kind of highlight how current the issue is. This isn't an issue from 5 years ago. It continues to be an issue today. And you can see by all the references of January and February this year is that people are dying, and there's so much more that we can do in response to the opioid crisis. Next slide. What's been kind of really troubling to me, I did a presentation recently comparing Canada and the States, is that life expectancy in the States, even before the COVID crisis, had actually been affected by the opioid crisis. And here in Canada, the same is true. Maybe not to the point of having an absolute negative effect on life expectancy, but pretty darn close. So Canada's been tracking life expectancy going back to the 1950s. And since 2015, 2016, the actual annual increase has been dulled or blunted by the number of deaths related to opioids. So it really is a significant societal problem here in Canada, as much as it's a scourge in the States as well. Next slide, Emily. Important to note, you know, in some ways, maybe I shouldn't be complimenting government, but it is true that I think Health Canada has really kind of taken a very positive approach in many aspects with respect to this issue. And the reason I point this out is that the graph here is not specific to any numbers, but really does show that Canada has taken a harm reduction in treatment perspective in many respects. And if you were to create a similar pie chart in the States, you'd see that enforcement or interdiction would be much larger than it is here in Canada. But the important point here I just wanted to make note of is the fact that harm reduction and treatment influence the development of the standard, the paramedic opioid standard. So next slide. So when I talk about the standard is that going back to probably 2015 is when the first discussions happened with government. I think it was Health Minister Philpott at the time had a discussion with her, and she was very much concerned with the opioid crisis and encouraged the paramedic community to put in an application with Public Health Agency of Canada and Health Canada with respect to their substance use and addictions program. So you can see that we pulled together 19 different collaborators to develop a standard, but then once the standard was developed, to also talk about the KT, which is the knowledge translation, and bringing forward the information into the broader community, not just the paramedic community, but also the first responder community and also to the public at large. So I can report, the standard has been complete. That was in January this year. And we're working on the toolboxes in support of the knowledge translation pieces. So next slide, Emily. So this is the standard from the Canadian Standards Association, and you can move to the next slide again. That this process, I really am kind of very much an advocate for working with the Standards Association. They have what I would say is a very robust, bulletproof process by which they develop a standard, and it really is a collaborative piece of work. So we made application, and this is how we got there, is through the Substance Use and Addictions Program with Health Canada, and that the standard was published this year. And part of that, and when I say a robust process, is that there was a technical committee that brought the stakeholders together, but also it brought in lived experience and individuals who are very much on the front line in terms of the healthcare advocates who may be working in an overdose prevention site, or somebody with lived experience who may be a former individual who had an addiction issue themselves. So it really was a robust process. Next slide, Emily. And this is just to explain a little bit more about how standards are developed within the standards group. I won't go through all of the pieces here, but you can just see, if you follow the little arrows around, that the important pieces is that, you know, there's a committee work that we actually published that were an intent of what we're intending to do. We solicit for people to participate. They have a balance matrix, which requires you to have not just your friends, but everybody who may be interested in this topic area. There's a public review part, there's a balloting part, and then there's a publication. So it really is a comprehensive process that speaks well to the end product as well, in terms of the rigor that goes into the process to develop the standard. Next slide. So here's an example of the document. What I'd like to point out is that the nuance here, maybe it's not a nuance, but the fact that the standard isn't specific to the or exclusive to the clinical component. So what I mean by that is it's not saying that somebody who is in crisis should be given 0.4 Narcan or given 0.8 of Narcan, or whatever the transmission method should be. That's not the intent behind the standard. The standard really was about looking at the perspective and the framework by which you, as a paramedic service, would support your community, and how paramedics can be advocates for harm reduction and treatment as well. So the important, I think the third bullet there talks about the full continuum of care, including the prevention, treatment, and referral of patients experiencing problematic opioid use. And it really is, I think, a nice way of framing it, that what paramedics do and what we do in the community is not in isolation of our community. So it really is incumbent upon us to be partners in the response, but partners in the prevention and the treatment. So I think this is a kind of a fascinating document that really leads well and supports how the paramedic community can support individuals in times of crisis, and also preventing crisis. Next slide, please. So once again, just to reframe some of the key elements, I talked about harm reduction in the response to the use, poisoning, and overdose, providing education, looking at a model of care, and also consideration of health and safety of our responders, communication and tracking, so to actually develop and have data and evidence for why we do what we do or how we choose to do our next bit of a response. So these are just the elements of the document. Next slide. When I talked about the last piece, so we have a standard, but then you also want to talk about the knowledge translation. And so we have a separate project that's ongoing right now, is looking at developing all of those elements based on the standard to create a toolkit that is consumable by paramedics, by paramedic educators, and also by first responders and the broader first responder community. An interesting piece too is this item here, where we've actually developed a peer-to-peer community where we're actually collecting information related to paramedic opioid information, and the information is consumable and to be shared amongst the paramedic community. So it really is a nice way for paramedics or the broader first responder community to be engaged in this. So that's the purpose of that slide. And I think there's one or two more. The important pieces here is how to access the standard itself. And so the reason I actually put forward the not just the links here is to spend just 2 minutes on how you access it. Canadian Standards Association is a not-for-profit organization. And once again, I don't work for them. I advocate on their behalf, and I have no other interest in this other than to say that for people to access this document, the CSA asks that people register so that they can have a view access. So if you go to their website, you go through the process, you do have to register, and then you can have a view access to the document. So it is free, it is in both official languages, and it is available, but there is a component that individuals do have to register to access the standard itself. Emily? So that's just in terms of the process, and I think Emily does make the slides available afterwards. So please take a look in terms of the process of how to get there. And next slide. Just hopefully I'm trying to stay within my time limit here. I think this really has been a societal issue that has lost some of its luster in the media. And I don't mean that in a way that is diminishing the issue. If anything, it's of great concern that we aren't talking enough about the issue of opioid related use, and the fact that arguably there are people who believe that COVID has actually made some of this worse. So when I say that it's a disorder, that's a societal problem, it's not just a health issue. I think that really is a foundational piece, that when each of us work on the problem, that we don't do it in isolation, and that we do work with the broader stakeholder community. So thank you for your time. Thank you, Emily, for helping me out. And there's contact information below if you have any questions or inquiries. Thank you, Emily.
Perfect. Thank you, Pierre. So if anyone has questions for Pierre, you can certainly let us know, and I'll ask them at the end. And I will share those slides after the session. So I am going to turn it over now to Deputy Commissioner Stephen White, who's going to speak about the RCMP's approach to mental health care for its members.
Okay, thank you very much, and thanks, Pierre, for that great information. Good morning and afternoon, everyone. Bonjour, bon après-midi à tous, et bienvenue. And thank you very much for giving me some of your time today for discussion. What I'm going to talk about is mental health of police officers and what we are doing, what more we need to do, especially during the the opioid epidemic that Pierre just gave a good overview of. And well, my time here today is going to focus on police mental health. A lot, if not all, of what we'll talk about is very relevant and completely applicable to the mental health of the broader first responder community in responding to a lot of mental health related issues, but including the opioid crisis. To begin, we're all very aware that policing is not immune to mental health issues, and in fact, police officers are most likely more at risk working in a policing environment. It's a reality that throughout their careers, many police officers will experience situations that the average Canadian is just not subjected to. Just day-to-day enforcement activities put police officers in frequent unsafe situations, as well as probably less frequent, but occasionally very traumatic events, whether it be motor vehicle crashes, child abuse, violent death of a victim, or just helping someone through their darkest hours. Just one of these incidents would probably significantly impact any person. However, police officers can find themselves dealing with multiple of these incidents in a single shift or a week, for example. And the reality is that policing, much more so than other professions, is exposed to critical and traumatic incidents in their daily work. And constant exposure over several years means it does not have to be one critical incident. It may just be the constant exposure and the cumulative effect of everyday police activities over many years that takes its toll on officers. So the bottom line is that there's a broad scope of activities, incidents every day, and everyday realities that are already taking its toll on our frontline police officers. And, as Pierre highlighted, here in Canada in recent years, a very real and significant added dimension that has been affecting police officer mental health is the opioid crisis. And because of their role in responding to opioid crisis, law enforcement officers experience additional physical dangers, mental trauma, and stressors, very similar to other first responders who are responding as well. And it's not just in large centers where this is occurring, as Pierre said. It's happening in every province across the country, in large centers, smaller communities, and even more remote regions of the country. For our police service just last year, we've been doing it for a number of years now. The RCMP officers administered naloxone 223 times to the public. So very, very much on the front line, and also trying to treat and respond to overdoses. And it's not just in big centers, as I said. Our officers in the Yukon last year, they administered naloxone to the public on 23 separate occasions. So their police officers are very, very engaged in frontline response to the crisis. So they can be and are very often the first emergency service personnel on the scene of opioid overdose. And what research and literature is telling us is that it's not just a traumatic event itself, such as responding to an opioid overdose and death, that can cause operational stress injuries. Many instances bearing witness to or failing to be able to prevent the harm or death also has the potential to be morally challenging and stressful. We know that moral injury is pervasive in many aspects of policing, but probably one of the most prevalent instances is when police officers fail from their own perspective to protect the public. These include situations that are out of their control. However, officers can still personalize the results and outcomes. And when it comes to the opioid crisis, witnessing and not being able to prevent harm or death can be common when dealing with many victims of opioid overdoses. So we as an organization, the RCMP, we're responsible for ensuring that needs related to police officers' mental health on an ongoing basis, as well as during the opioid crisis, is a top priority. And there are many aspects to this, including awareness and education and training related to trauma or stress exposure for officers responding to the crisis, as well as providing, a lot of different support and services. And what I'm going to do now is maybe just give you a quick snapshot of how it is impacting officers, and I'm just going to jump into a number of things we are doing, resources and programs we have in place. So just give you a sense, the research that was done in 2016-17 by CIPSRT, who's hosting this event today, their research showed that in the general population, PTSD was at 2.4%, and the RCMP was at 30%, high as well for other police services, municipal police services. And other mental health issues are much higher in policing than in the general public. And we know it is increasing for us, for RCMP members. For the last 4 years, 2016 to the end of 2020, the increase in operational stress injuries, PTSD, for released retired members, the increase was 77%. For serving members, the increase was 67%. So, and according to our Veterans Affairs, operational stress injury and PTSD is the third most common medical condition among RCMP veterans after hearing loss and tinnitus. So there is some urgency in providing the necessary help, support, and resources. That's what I'm going to give you now is just a quick snapshot, because we don't have much time, so I'm going to run through it fairly quickly. But I'd start off with training. Like a lot of other police services, first responder organizations, we also adopted Road to Mental Readiness training. It is foundational training, but it does increase an employee's mental resilience and helps to reduce the stigma associated with mental illness. We provided this to every employee, 30,000 employees across the organization, all new employees as well, and we've also incorporated into our training at our training academy for our new cadets in Regina, Saskatchewan. So, nice thing about that is that, our cadets, they're at least getting a foundation, in mental health even before they start their first day as a police officer on the street. So I think that is very helpful for the long run. And I'll talk about some other training after that we're doing, just incorporating in our training, cadet training program as well. Our suicide awareness and prevention resources include an online course for all RCMP employees, as well as applied suicide intervention skills training. That's a 2-day interactive workshop in suicide first aid that teaches participants to recognize when someone may have thoughts of suicide and work with them to create a plan that will support their immediate safety. And we have a suicide prevention, intervention, and risk review guide. That really is to increase employee supervisor awareness of suicide prevention measures and to increase employee supervisor awareness of how to intervene and support colleagues who may be at risk of suicide. And we also have a very comprehensive internal suicide prevention info website. This also links employees to numerous external resources that specialize in suicide prevention, education, and provides information on where an employee can get support for themselves or a colleague at risk. We've adopted and made available, to all employees, LifeSpeak that offers online training through hundreds of short videos and expert blogs on various mental health related topics. We've implemented a very robust peer-to-peer program with peer-to-peer coordinators and advisors right across the country who have received focused training on the services provided by Health Canada Employee Assistance Services, which I'll talk about in a sec, as well as services that are available within and external to the RCMP. So the peer-to-peer advisors can be a very confidential and valuable link between the employee and a range of services and support that can be available to them. And right now we have over 500 peer-to-peer advisors across the country in our organization. In 2018-19, we had over 5,600 employees who reached out to peer-to-peer for assistance. Last year, this number increased to over 7,600. So, and a lot of the outreach to our peer-to-peer is mental health related. So it's good to see people are reaching out. Over the last couple of years, we have also been implementing a support for operational stress injuries program, SOCI, across the country, and it's really modeled after the D&D and Veterans Affairs Operational Stress Injury Social Support Program. It offers peer support to employees and does that through one-on-one meetings, group meetings, and connecting peers with each other. To date, we've only had this in place for a couple of years. SOCI has helped over 1,000 peers with support and resources, so very positive. In terms of critical incident stress management, critical incident stress management online course was developed and implemented in our organization to assist our employees on how to recognize the effects of critical incident stress. This training also explains the potential outcomes of critical incident stress, identifies potential problems that may be created by critical incident stress reactions, and initiates a discussion of responses to critical incident stress. For us, critical incident stress debriefings are required and occurs whenever there is a critical incident. And these debriefings can also be very important and effective following an opioid-related incident. And I'd highlight that supervisors have a leading role in ensuring this takes place. And to support managers and critical incident commanders, a critical incident stress management aftercare guide was developed and implemented to highlight roles and responsibilities and to provide a compilation of resources and guidance for individuals who are responsible for coordinating and managing responding to a critical incident, as well as the application of aftercare services and resources. We also have a reintegration program that's based on the Edmonton Police Service Reintegration Program, and it's a peer-driven program dedicated to ensuring members who have been involved in a shooting or other critical events were comfortable using their intervention equipment again prior to returning to full operational duty. So the pilot that we've run has been very successful in supporting member wellness and psychological operational fitness for duty after, as I mentioned, member involved shooting or critical incident or even long-term leave. So this is proving very successful as well. We now have 65 members who have been trained as reintegration facilitators across the country, and we've had already over 150 members who have been supported through this program, and we're now in the process of doing a total national rollout of this program. We've adopted the Canada Life, formerly Great West Life Health Risk Assessment online tool for our employees that is designed to help employees identify risks to their well-being and build an action plan to maintain or improve their overall health. Then I'll jump in. I only got a few minutes left, but in terms of more direct support, we're fortunate. We have, across the country, we have 11 occupational health services offices, that maintain health teams of medical doctors, psychologists, and occupational health nurses who oversee and monitor the health of our RCMP members. They are not treating healthcare practitioners, but they do monitor the occupational health of our members. Over the last few years, we made some significant investments to build a disability management and accommodation program. This really is intended to promote, member illness, injury recovery, and health through very proactive case management of our employees. And a big part of that was hiring 25 disability management advisors and 11 disability management coordinators across the organization. And we also put some big investments in IT systems to support that program. And I just want to put that in because I wanted to highlight that disability management, case management is a very important aspect of successful mental health care. We just launched last month the psychological health screening program for our members. So they will have a comprehensive screening assessment with a mental health professional every 3 years, and that's going to be aligned with our physical health assessment every 3 years. So we've been hiring dedicated psychologists across the country specifically for this new program. And it's really to provide early detection and intervention of operational stress injuries. And this is very important because we've seen over the last number of years, we've had, a lot of our police officers who have been accumulating operational stress injuries over many years. And, by the time it's detected, they got 15, 20, 25 years of service, and the injuries are fairly significant at that point. By doing this full psychological screening assessment at least every 3 years, we're hoping to get a lot better at early identification and intervention for operational stress injuries. We also offer short-term counseling to all of our employees and their dependents by Employee Assistance Services through Health Canada, and that includes 24-hour crisis and referral center. Again, we're seeing very positive trends year over year in terms of our members and other employees and family members who are taking advantage of that service. Our regular members across the country have access to psychological services via telepsychology, phone and online through Medivie Blue Cross. We're also participating in Saskatchewan in Quebec with some of you may be aware of it with PSP Net, an internet-based cognitive behavior therapy program, getting great feedback on that, and we're hoping that is going to roll out to other provinces and territories in the near future. And we've also, I think a lot of you are aware of Wounded Warrior Canada as a national mental health service provider. They provide some great programs such as trauma-informed workplace training, operational stress injury group-based programs, and we've recently made available as part of our occupational health benefits for eligible members to be able to receive support from some of these programs. So I think that's very positive. Just the last 2 points I would make. I'd really like to highlight that we're in the process undergoing a multi-year longitudinal research study of our RCMP cadets who are going through our training academy to investigate the effects that policing has on the mental health of police officers. So, the ultimate goal of this study is the development of an evidence-based understanding of how and when operational stress injuries develop in first responders. So we will be able to really tailor training and treatment and develop the best training possible to reduce risk and increase resilience and be able to enhance treatment efforts. So the RCMP graduated its first troop of cadets that have participants from this study, groundbreaking study and research in October 2019. And through this research, we'll get to see what is happening with our new police officers in the field as they go about the many daily police activities that I mentioned earlier. That can have a significant impact on their mental health. And that study research is being carried out, I think, by an exceptional group of researchers at the University of Regina, led by Dr. Nick Carlton, which I think most folks on here are very familiar with. And I cannot overestimate the importance of this one-of-a-kind research that will be used for the benefit of the broader first responder community in the coming years. And then the last thing I would mention, I'd like to highlight, is a unified protocol psychological treatment designed to improve the mental health of individuals who have been diagnosed with mental health injuries. It has been tailored to support the RCMP, our longitudinal study that I just mentioned, and we'll be including this in our cadet training program as well, really to improve the mental health resiliency of our new police officers going out into the field. So, and I think my time is up, and I will just leave it at that. I know it was quick, but I just wanted to give you just a very quick snapshot of a number of tools, resources, and support that we've put in place.
Thank you so much, Commissioner White. What a wide variety of options that you're offering for your members, especially when the issues seem to be increasing. So thank you for sharing that with us today. Dr. McElheran, I am going to turn it over to you. Do you have slides that you want to share?
I do, yeah. I could.
I will give you that control then.
Okay. Did that work?
Yeah, I can see it. You just need presentation mode, I think, and we're good.
Perfect. Okay, is that good?
Yep, we're good.
All good? Okay, perfect. Well, thank you very much for allowing me the opportunity to participate today. Commissioner White and Chief Poirier, I very much appreciate your perspectives on this opioid crisis and the impact on PSP across the country. I certainly am very much with you that this is a problem, and these issues facing PSP are problems that really require joint and consistent effort across the country to try to get a handle on it. So I'm really going to come today and speak from the perspective and capacity as a clinical psychologist and the work that I do sort of day to day. Today is actually a kind of a nice representation of that work. Today I will see 2 paramedics, a firefighter, a Calgary police member, an RCMP member, and a member of the Canadian Armed Forces. So I have the benefit, I think, of being able to connect with PSP on a very one-to-one sort of ground level, frontline sort of basis. And in preparing for today, I asked a number of folks that I work with just to give me their perspective on what are the kinds of things they're experiencing relative to the opioid crisis, and what would be some of the pieces of feedback or things that they would like people to know. And this slide just sort of speaks to a few of the comments or a few of the ideas that were kind of provided to me. One of the things that is very consistent for PSP that I've heard over the course of my 20-year career is, oftentimes it's not the dissemination of their actual job and actual duties that kind of is the trouble or where the accumulation of potentially traumatic events and stressful events comes from. If a paramedic is offered the opportunity to disseminate a protocol relative to a medical intervention, that really is the wheelhouse, right? That's what paramedics know how to do. Same thing with fire suppression, and oftentimes, kind of protocol interventions for police officers, etc. The challenge oftentimes starts to come or is experienced in all of the things that are happening in the environment and surrounding whatever the particularly potentially traumatic event is, right? So, I had a police officer who told me last week that, recently he was at the scene of an overdose, and it, didn't look like the person was going to survive the overdose. and the 4-year-old child was in the room sort of watching this happen, right? And that it was the experience of seeing that child witnessing what was happening to his father that really was what was difficult for that police officer to be able to walk away from at the end of the day. You know, I know Commissioner White mentioned this, and I'm going to speak to this in the next slide. When we're talking about the opioid crisis and we're talking about specific types of critical incidents, the potential for those moral injuries is very, very high. I very much agree with that perspective. You know, and one of the things that is very hard for PSP is this this fact that they are faced with day in and day out of the truly, you know, horrible things that human beings can do to one another. And lots of times addiction and mental health struggles and all the marginalization that a lot of people struggling with opioid addiction face. This is kind of a ripe environment for some of these almost crimes against humanity to be perpetuated. And it's really challenging for PSP to, you know, kind of be out there day in and day out and just continually being exposed to these kinds of, you know, sort of community level challenges where there doesn't seem to be a ready or easy solution for which they can engage in, right? So, you know, this notion of seeing bad things happening to good people, right? Whether it's the crimes of opportunity that I had on the last slide, or you know, people who potentially just had a whole variety of things destabilize in their life, and that there was a sort of sequelae of that, which I suspect we're going to see quite significantly as we continue to move through the COVID-19 pandemic and probably in the aftermath of, that a lot of people have experienced significant losses of just their psychosocial functioning, right? Losing jobs and potentially not being able to make mortgages, and the impact that that's having on families and marriages, and sort of the line of sight that that's going to give us to probably some years to come of people really struggling significantly. And we can anticipate that addiction and potentially opioid addiction is going to be a significant part of that, right? And it's really hard psychologically and emotionally speaking to kind of come to terms with that when you are a police officer, a firefighter, a paramedic who's kind of coming to work every day facing that over and over again. You know, this is a group of people, in my experience at least, that tends to have a tremendous amount of integrity, tends to have an incredible work ethic, right? And really comes to work with a true desire and spirit of wanting to help and wanting to be of service and wanting to kind of help people overcome the problems that they're facing. And so this potential of continually being exposed to problems that don't have ready solutions, you know, that's a lot of this erosion that we see happening, right? I find it, I'm quite frankly thrilled to hear of the programming that's happening that Chief Poirier and Commissioner White spoke to. You know, I think that where we're at right now in kind of PSP mental health is there really has been an awareness in the last 5, maybe 10 years, but certainly the last 5 years, of the rates of psychological injury that PSP are facing, and the fact that there really is a sort of mental health crisis going on within PSP communities. With that awareness, what we're able to do is we're able to start influencing change and putting programs into place, and, you know, paying attention to prevention and early identification. I'm so thrilled to hear that. We also have to understand that, right, these moral injuries and these experiences that PSP have been having historically for quite a long time, there's a lot of people out there who are still significantly injured, right? The fact that we're seeing rates of operational stress injuries, post-traumatic stress disorder increase, I don't think we're sort of at the crescendo of that wave yet. And I think we have to be prepared for that as mental health providers and leaders and policymakers, et cetera, to really understand that, you know, the accumulation of stressors that many PSP members have been facing, the awareness alone is not going to be the antidote to that. We have to be prepared and ready to continue to support and sort of speak and understand to these kinds of experiences PSP have within the context of their work. Okay, so, you know, what I hear, you know, fair or not, right? What I hear day in and day out, probably at least once a day, if not multiple times a day with the folks that I work with, is this true sense of, I don't really think other people understand what I go through. And other people typically is not peers, right? Typically it is maybe members of the community, right? Significant scrutiny, defund police, you know, questioning about, you know, are PSP doing all that they can to sort of intervene appropriately? So this real sense of being misunderstood by the community that they're serving, you know, oftentimes or at times, oftentimes there's significant concern about, do my leaders, do my supervisors really understand what I'm going through on that front line and in that frontline experience? And, you know, and how do I bring this home? Frankly, a lot of PSP don't want to bring sort of what they experience at work home to their families. families because they worry about the risk of impacting their family members with, you know, kind of the stories and the vicarious trauma. So what happens is, or what's happening, at least as far as I'm hearing it, is we have people who continue to feel this sort of persistent experience of invalidation, right? And I'm fond of saying, and you know, we talk about this a lot in mental health circles, one of the things that we really powerfully crave as human beings is the sense of being understood by others in our social environment, right? When we feel like we're being understood, when we feel validated, that actually helps us to feel agency and masterful in our lives. And conversely, when we have this experience of sort of being invalidated, that can lead to isolation, that leads to anger, resentment, bitterness, and all of these kinds of things that we know can be really, really unhelpful for psychological health and well-being, right? So, you know, this is a really broad topic and a really big subject area that I could talk about probably for the rest of the day, and unfortunately only have about 5 minutes or so left. But, you know, one of the things that I really thought about kind of wanting to share as a takeaway or as a key message sort of in this talk is really, you know, one of the things that PSP are challenged with thinking about moral injuries and the chronic sort of exposure to traumatic events that they experience is, you know, one of the things that they're challenged to offer is empathy, right? They're challenged to sort of turn up to these critical incidents and be able to extend, you know, support and engagement and manners and all of these things to the people that they're trying to serve. And that really takes a toll on their ability to sort of be empathic, right? They're constantly sort of being asked to dole out empathy and care to the people around them. And when there's this experience of sort of not receiving that sort of care and empathy in return, that can be really what wears away. So, you know, I think that in public safety sort of cultures over the course of, you know, however many years, one of the things that has been challenged is really teaching and supporting PSP members, their peers, their leaders, etc., to really know how to truly engage and offer, you know, sort of accurate empathy to each other relative to the experiences that they have. I was talking to a paramedic just the other day and was chatting about this issue, and he sort of said, you know, one of the things that I wish could happen, like especially after an opioid death, he had just told me a story of being at an overdose of a 16-year-old and witnessing somebody that she was getting high with, rooting through her belongings while she was laying there in overdose, right? And so we were sort of talking about that experience on him. What he said was, I wish I'd gone back to the station and my supervisor had just been there and it just automatically said, got it, like just take an hour, take a couple of hours, sit down, you know, process, what do you need, right? And sort of this automatic empathic understanding that that might have been something that it would have been helpful for him and his partner relative to that particular call, right? That same paramedic talked to me about a really positive experience he had had with the supervisor recently, where the supervisor sort of said, you know, yeah, it's been a while since I've been truly on the front line. Could I come out with you? And my client said, yes, absolutely, let's go. And they spent a day with the supervisor kind of riding along. And what he was left with was this experience of, I've got all day long and all the time in the world for that guy moving forward, because he really tried to get into my lived experience, right? So, you know, I think, you know, again, as a takeaway and something we can offer to PSP relative to the opioid crisis, relative to these very, very difficult jobs that they have, is really trying to just drill down into where's the point of empathy, where is the sort of the pierce through of the armor maybe that we can get through it, and really trying to connect with, you know, what might be the perspective that the PSP has on this, what they might they be experiencing in a moment or through these moments of attending to opioid overdoses, and really recognizing that being able to demonstrate and sort of offer that empathy and validation to a PSP member does not have to be difficult or challenging. It can simply be a matter of asking a question. What's going on for you? How was that for you? Right? And so, you know, we have to kind of recognize and understand that given the sort of ongoing societal concerns that are happening, the persistence of calls, the call volume that's going up, the challenge, you know, to resources generally speaking, this issue of empathic concern and really being able to sort of be present and pay attention to what might be happening to PSP, their peers, and in their organizational environments, this is going to continue to be a really challenging area and something that we just need to be very mindful of, you know, those of us who are trying to support PSP, to really try to understand, like, where's the barrier to these folks really being able to validate and understand one another and really be able to offer and attune to the empathy that is required. So I think I came in right at the number there. So, you know, I want to, you know, thank everyone for this opportunity to speak today. I really think we need to orient ourselves to the fact that what we're talking about and what is really probably quite necessary relative to mental health and psychological improvement and fitness in our PSP members is going to be culture change, right? We have to understand that PSP have been living in a culture that historically, up until very, very recently, has sort of, equated vulnerability or difficult emotions with weakness, right? And what we're really sort of starting to do with this awareness that we have of mental health and psychological injuries and prevention and early intervention programs is we're starting to look at changing sort of operational service culture. And that is not the kind of thing that changes overnight. So, I mean, I really think that for those of us who are working on the front line, those of us who are trying to make decisions from, policy perspectives and process perspectives, there's a lot of patience and compassion that we need to have for ourselves and to the process, right? This is a problem that's going to take a while to sort out. But what I think is really key and really important is that the conversations have started, because the more we're able to talk about these things, the more we're able to name and label and just understand some of what the realities have been for PSP, the more likely we're going to be able to actually, produce and engender lasting and persistent change moving forward. I'm done. Thank you.
Thank you so much, Dr. McElheran. I think you really spoke to an issue that we heard in our previous webinar when we were talking about experiences of PSP, and it was a frustration level with having to attend the same call all the time or the same person and having the same thing happen daily. And I think that you kind of spoke to that idea as well of that idea of empathy, which was great. I think that was very accurate. So we do welcome everyone to submit questions now. As I said before, you are free to submit them through the questions box, or if you prefer, you can raise your hand and I will unmute you so you can ask your question. Both Chief Poirier and Deputy Commissioner White are bilingual, so feel free to ask your question in either language. So I am going to start with a question for you, Pierre. It is a question that says, sorry, I'm just going to read it here. So you had indicated as part of the standard there was support for the health and safety of the first responders involved. Do you think that this standard itself provides some kind of help for them because it gives them a clear direction of how to handle the crisis?
Yeah, thank you, Emily. There's probably two parts to the question. That the standard is specific to opioids, but also does make reference back to another standard called the Psychological Health and Safety in the Paramedic Service Organization, which is linked to this standard with respect to the using the same language and definitions. So the opioid standard relates to how we would look at a framework to support our community in a broader sense, with reference to first responder safety to paramedic safety. And then it's linked back to this psychological health and safety standard, which talks specifically about how we support paramedics and their mental health well-being. And I think there's a lot of linkages there that are really important. And opioids is a crisis in our community that has a negative impact on the first responder community. And we have to do a lot of, I'd say, interactions to support the paramedics, but also to support the PSP. And probably I just want to give a shout out to Deputy Commissioner White on his, and I was just typing it into the chat, on his comments with respect to PSPNet and the research that's taking place, and really the positive results that we're starting to see on internet cognitive behavioral therapy. And I think it's something that is evidence-based, evidence-informed, that really is a positive for the paramedic community, and also has that high degree of confidentiality and privacy, which I think is important. So myself as an employer, I'm smiling at the comment with respect to empathy, as I have empathy for staff that are in these situations. But in some ways, almost as important is that there is a good avenue by which the individual can feel safe and reach out to a product that can improve their mental health and well-being. So I think that really is kind of an important piece here. So thank you for the question, Emily.
Okay, thank you, Pierre. Stephen, this one is for you. With all of the programs you've listed, how do you map out where they fit in your organization and how they work together? And then how do you evaluate and monitor their efficiency? Do you have programs in place to do that?
Yeah, no, great question. It's something we're just starting to put a focus on, and we put our initial mental health strategy in place in 2014, where we started a number of these programs. The big gap that we had was how do we assess their effectiveness? And so as we put in newer programs and a lot of the ones I talked about, we are building criteria that will enable us to measure the effectiveness. We're just doing that now, but we realized that was a big gap in what we were doing to see what the impact of these programs were, measuring them and following them and getting the results. So we are putting a big focus on that right now, moving forward as we roll out our new wellness strategy for the next 4 years. But I comment, just like to add on as well to what Dr. McElheran said. Very, very good point in terms of that culture change. I went through, a lot of different things we're doing, but I would highlight. I think that is just the beginning. There cannot be any status quo with regards to mental health and support we're providing to our employees, regardless of the organization. It's got to be a continuous evolution. And back in 2014, we started doing a lot on awareness, trying to reduce the stigma. We're in 2021, and we've done a lot. I think we're still hearing that stigma is still a very, very real concern for a lot of our members and employees. So it's not something that's going to, completely change overnight. It is a longer term path that we're on. So.
Perfect, thank you for that. Dr. McElheran, just a question for you. In the course of your practice, have you seen that there's a preference that PSP have for the way they engage with mental health services?
Sure, yeah, absolutely. So what I have seen probably most success with is peer-to-peer interventions. So again, I'm really happy to hear that there are peer-to-peer programs that are being developed and disseminated. And I think we actually have some recent data that's come out of CIPSRT to support that, when looking at where are PSP likely going to, sort of turn for help relative to mental health concerns, it's either a spouse or it's a peer, right? So I think that's why it's really, really important that every PSP organization have some kind of peer support strategy, that there's some way that when peers are struggling, that there's ambassadors for mental fitness and mental wellness within PSP organizations. So you've got some vocal people who are prepared to talk about the ways that they take care of their mental health, which I've been seeing more and more and more. And then frankly, from a clinical and psychological perspective, one of the things that I'm really focused on, and I know a lot of other groups across the country are, and we certainly are within the clinical subcommittee for the ARCNAC, is the development of a network of culturally competent clinicians, right? So, it's really important that as a clinician working with PSP, that you have some understanding of what the lived experience of working as a police officer or paramedic or a firefighter is, right? Because that's oftentimes one of the barriers to continued engagement in psychological or mental health treatment, is a sense of, again, not being understood. So make sure that PSP have peers and a sort of path to access to engage with peers, and hopefully have ways that you can help them get supported with culturally competent clinicians. Those would be sort of two major takeaways from that perspective.
Perfect. Thank you so much for your answer. I'm just going to kind of put a last call out there for questions as we get ready to wrap up. So if you have a question, go ahead and raise your hand or submit it through the question box. I'll give a couple of moments here for that. Just as a last thing, as we're waiting for that, I'm going to throw up a poll actually that asks how you feel that your organization supports you in dealing with the opioid crisis. So just give me 1 moment here. I'm just going to launch that for you. All you have to do is go ahead and click on the answer that best reflects your organization. Okay, I'll give you guys a few more seconds to finish answering. All right, so go ahead and close that one here. So it looks like, I'll share the answers with you here. So it looks like a number of you, 28%, do have organizations that are always supporting you, which is great to hear. And that 72% of you say that sometimes your organization supports you. So I think since there are no no's in our responses, I think that's actually really great progress. I think with all the programs that we're having now, that people still, it's not always, but they do feel supported some of the time. So I think that's good progress, and maybe we'll do another session like this in a few years and it'll be all yeses, which would be great. So it doesn't look like we have any other questions, so I'm going to go ahead and wrap it up for today. First of all, a big thank you to all of our presenters for providing their time today and for giving such great information to our audience. Thank you to our audience for attending as well. There'll be a quick survey at the end of the webinar. We hope you take a moment to complete it. We also hope you'll consider joining us for our next town hall, which is not until April 15th, but that one we are going to actually take a look at peer support programs. So keep an eye out for the registration link, which will be available soon, or you can subscribe to our events list to get notified of upcoming events. Again, thank you so much to our presenters for all the good work that you are doing with PSP Mental Health. To everyone out there, take care and stay safe.
Thank you.
Thank you.